Hello, I'm Dr. Arthur Evans, CEO of the American Psychological Association, and I want to talk to you today about psychology's priorities for federal health care policy and ask for your help in contacting Congress regarding this vitally important matter. Today, more than 30 million Americans remain uninsured, while others purchasing individual health insurance plans may face painfully high premiums. Also, more than half of Americans with a mental disorder and about 90% of those with a substance use disorder go without treatment. We can and must address these serious problems. APA is committed to achieving universal access to mental health and substance use services at parity with physical health services. We are also committed to maintaining strong health insurance protections and reducing health disparities. Our bottom line is simple. Any health care legislation passed by Congress should increase, not decrease, the number of Americans with health coverage for mental health and substance use services, including opiate addiction. Unfortunately, Congress is moving in the opposite direction. In April, the House of Representatives passed legislation known as the American Health Care Act, which would cause 23 million Americans to lose health insurance coverage over the next 10 years and would remove important protections from tens of millions who retain coverage. The Senate is moving quickly to vote on health care legislation. The Senate bill, written behind closed doors, adopts many of the American Health Care Act's fundamental flaws. These include ending Medicaid as we know it and ultimately denying millions of people access to behavioral health services and ending Medicaid expansion programs in 31 states and the District of Columbia. The Senate bill also ends the requirement that private sector health plans cover mental health and substance use treatment and other essential services. We're also concerned about the adequacy of the refundable tax credits to help working Americans afford private health insurance coverage. As a former commissioner of Philadelphia's behavioral health system, I know how catastrophic these changes would be for our nation's health. Congress should enact legislation to help individuals afford their own coverage as well as strengthen the Medicaid program. The APA and the APA Practice Organization, together with virtually every other healthcare organization in the country, have been pushing back against these proposals. I hope you've seen some of our action alerts that we've sent out over the past several months, which are posted on our website. If you're one of the thousands of psychologists who have responded to these action alerts, I want to thank you personally. With the Senate taking up the bill, we're now at a critical stage in the battle. We need you to weigh in. Please take a few minutes to contact your senators to ask them to move forward, not backward, on health care reform and to vote against any legislation that would undermine essential health benefit protections or result in Americans losing health coverage. Use the links at the end of this video to send an email to your senators. Thank you.